within 24 hours. We want to keep the presentation short so we have plenty of time to hear comments. So just going to do a brief overview of the project objectives and then some sample prompts to help frame the conversation for today. And as Michelle had said, specific feedback specifically on codes or questions, you are always welcome to submit them to the rate setting eval at maine.gov email address. So you can move to the next slide. Thank you. So the purpose of the evaluation is to develop a system for establishing and maintaining rates that are sufficient to sustain the financial viability of the providers, as well as ensuring Maine Care members have access to high quality services. And to really evaluate Maine Care's rates and rate setting system so they can have a plan for creating a comprehensive, streamlined, and coherent system moving forward. Looking at the timeline of what has happened and where we're going, in November is when we released the cataloging and benchmarking report and workbooks. We had provider listening sessions in October, which I hope many of you were able to attend. We had member listening sessions in November, and now this is the second round of provider listening sessions. There will be interim findings released in January, and then the final report is actually at the end of February. And on the slide, there are some of the things that will be included in the report, including candidates for APMs, baseline recommendations, and the priority list and work plan. You can go to the next slide. Thank you. Just to sort of lay some ground rules about how the meeting is going to work, it's our job to ensure that you keep your comments to announce time limits. With the size of this meeting, I'm not going to put hard limits on how long you can speak. I'm just going to ask that everyone respects the time and leaves enough time for other people who would like to speak to do so. Also to ensure that you stay sort of on topic under discussion, and then to record the meeting to make sure all the comments are captured. Your role is to introduce yourself, your organization, and the services you provide. So that helps us to associate your comment to the right section. And if someone has made a good point that you agree with, it's totally fine to just say, I agree with that, rather than repeating it. And then again, to just respect the time limits, the time limitations of the meeting, and the need for everyone to be able to speak if they would like to. Go ahead and move to the next slide. Thank you. The purpose of today's meeting is to really gather the additional points that you would like for consideration regarding the rate comparisons, and then also to give us some feedback on sufficiency of your current rates and how that relates to their impact on access or sustainability. We put together some sample discussion prompts really just to help guide the way that the feedback could be helpful for us. Are there assumptions or costs that are critical to consider that are unique to Maine that wouldn't be reflected in another state's rate to provide some of that context? Are there differences in payment methodology, services that may explain some of the differences in certain rates, though it would not necessarily be evident by just looking at fee schedules and service descriptions? Are there services whose current rates contribute to access or quality issues, and then do those issues impact other parts of the service system as a result? So those are just some guiding prompts to help start the conversation. I'll go ahead and ask everyone if you would like to speak to put your hand up. Like I said, if you can't find the raise hand symbol, please don't hesitate to chat to us in the chat box, and Jillian can unmute you. So we're not seeing any hands. So is everyone able to find the raise hand, or if not, the chat box to ask to be unmuted? Oh, there we go. We have a hand.
Yeah, first I've got Nicole Clegg.
Hi, everybody. I hope you can hear me. I think I've unmuted myself correctly. My name is Nicole Clegg. I'm the Senior Vice President of Public Affairs for Planned Parenthood of Northern New England. And first, I wanted to just thank you for the opportunity to provide this input regarding the payment methodology used by Maine Care to reimburse healthcare providers We really appreciate the thoroughness and transparency of the project to date. As a part of our review of the recently published policy-specific workbooks that compare main care rates to those of other payers, we'd like to offer several perspectives. First, and I will just highlight two CPT codes as sort of examples of what we found in the analysis. When you look at 99203 and 99213, you see that family planning providers are systematically undervalued compared to other providers. And this is especially worth noting when you consider the enhanced federal to state match that Medicaid provides for family planning providers. More broadly, we would ask that as state leaders consider the future of Medicaid payment, informed by the sustainability challenges faced by primary and preventive providers during the COVID-19 pandemic, that you explore models that reflect and value the broad range of services offered by family planning providers. We know through our experience that we are often the preferred primary and preventive care provider, especially for women of reproductive age in the state of Maine and across the country. And, we would point to the reimbursement model that's used for the federally qualified health centers to serve as a guide to more appropriately reflect the breadth of and scope of the care that we're providing to our patients. We believe that if you were to view the work that we're doing in family planning centers, there would be many similarities to FQHCs, including how patients are seen and the services we deliver. We'd encourage using that type of standardized clinic financing, which, unlike our current rate structure focused solely on provider type, fully supports the setting and the care we provide. Finally, I would just note that in our analysis of the information that was provided, we found that there wasn't data related to abortion procedures, and would just hope that that would be added. Thank you.
Thank you, Nicole. Next up, I've got Dan from the chat.
Hi, is my volume working?
Yes.
Hi, thank you for the opportunity to speak today. My name is Dan Morin. I'm the Director of Government Affairs and Communications for the Maine Medical Association, the largest physician organization in Maine, representing 4,300 physicians, medical students, and residents. Thanks again for allowing us to add some comments. Ensuring on Section 90, by the way, physician services, ensuring adequate main care rates for our independent physician-owned practices is an important goal for the MMA. The services are reimbursed through the physician fee schedule, as you know, not according to other cost-based reimbursement methodologies. Maine physicians feel that they have an ethical obligation to serve Maine care beneficiaries, although most independent practices need to impose some limits to ensure a financially sustainable payer mix. It's no secret that many have multiple chronic conditions, some being major. And as Dr. Shah says during his daily media briefings on COVID-19, as the number of variables rise during a pandemic, so does the number of uncertainties. And with these high-level medical needs that many are going through, and the unmet social needs that accompany the pandemic, now's an important time to emphasize that prior to the initiation of this rate evaluation, we've joined with the Maine Society of Anesthesiologists, Spectrum Healthcare Partners, in expressing strong objection to any Maine care rate cuts, and especially the previous cuts for anesthesiology services as being inadequate for access. As I previously said, COVID-19 is making the contrast between the haves and have-nots more apparent than ever. The goal for anybody, and I'm sure the goal for Maine Care, is that all people have access to the services they need when and where they need them without financial hardship. So there's a fear among our practitioners that we commonly hear that there's the increased anxiety, depression, trauma, and substance use disorder increases that we're hearing about through the pandemic are the aftershocks that are going to be crippling for many patients. So ensuring access to care for those patients for our independent physician practices is paramount. And we just hope that there are no rate cuts And we are excited that we have the ability to maintain the ACA primary care payment enhancements with state general fund dollars that we were successful in working with the state to accomplish a few years ago. Be happy to take any questions. We plan on submitting some written comments before the now extended deadline of December 11th. Thank you for that. I just read that in my email, so we appreciate it, and have a great weekend, everybody, and we'll be glad to help out in any way we can.
Okay, thank you, Dan. Let's see. I'm not seeing any, oh, here we go. I've got Rhonda Wooden.
Hi, I'm Rhonda Woodman. I work for Maine Family Planning, and I agree with Nicole Clegg's comments. I just have two more. When I look at the spreadsheet for the Section 30 Family Planning, the rates for the J codes for Connecticut, I believe that they use a different methodology, and that's why they're so out of sync with all the rest of the states, including ours. So, you know, we would ask that that get thrown out or taken into consideration, because I think it artificially lowers the comparison rate, because there's actually a much bigger gap between ours and the other states. And the other one is we actually also have a primary care clinic. Our primary care provider is a nurse practitioner. And because of that, even though she provides all the services for a primary care provider, including she can be a PCCM provider and everything, she is not eligible for the enhanced reimbursement rate for the ACA. So her rates are much lower than everybody else's, which, you know, causes a financial gap in our Ellsworth clinic. And also underneath that same section, because we have nurse practitioners doing it, we are actually paid underneath the APRN for our open door clinics, which is our transgender clinics. And there is a huge gap in there as well. And those are really important services. We also, in addition to seeing main care patients, obviously we see third-party insurance, but we offer a sliding fee scale for those services as well. So, you know, in order to, we have to be able to financially sustain being able to provide those services that are often the only care that these patients get. And that's it. Thank you.
Thank you, Rhonda. Okay, I'm not seeing any new hands or comments in the chat. If you have any additional comments, please raise your hand or chat at me, or Q&A. I'm monitoring all of the tabs here. Okay, Julia.
Okay, so I'll open it up if there's just one final time. If there's anyone who would like to give feedback on this and has not always already done so. If not, please don't hesitate to send written comments to ratesettingeval@maine.gov, and we will absolutely read them. Not seeing any other raised hands. I will thank you guys for spending part of your lunch hour with us, and hope that you have a good rest of your Friday and a good weekend.
Thank you.